Breast cancer, cervical cancer, mental health and pregnancy are just some of the issues affecting women's health around the globe. In the region, the rising awareness and developments in this sector are driving the demand for better healthcare for women. In response, medical and health experts are highlighting issues that place women's lives at risk. At the 4th Obs-Gyne exhibition and congress, Khadija Saleh has this report.
Cancer and heart problems account for 4 out of 10 deaths among women in the region, while obesity affects 38% of the female population. These statistics provide a grim picture of women's health. In an effort to prevent the mortality rate from rising in the UAE, various campaigns are being carried out nationwide. Among these is Think Again, an awareness drive on cervical cancer and available preventive measures.
Some people, they don't know even what is the cervix. We will tell them about the lesion, where it is, and how to prevent it, either by giving vaccination, and for the married lady, they are supposed to have, pap smear regularly every 3 years.
It's a really good opportunity, as I say, for the really high calibre of local doctors here to explain some of the issues that may be different from other parts of the world, and also from some of maybe the more experienced doctors from the United States, for example, to maybe share some of their knowledge and help the doctors in the region.
Maternal health is another concern due to the lack of a standardized model of midwifery in the UAE, which the new Nursing and Midwifery Council hopes to change.
What we found is that lots of Emirati women are approaching us, myself and the teacher Rosie, at the colleges and at Corniche Hospital. They're approaching us for advice on how they can become direct entry midwives. And this is a model that's very well established in the Western world, particularly in the UK, that midwives train just as midwives, they don't train as nurses first. And in order to create a sustainable future for midwifery, this is the vision that we'd have as the way forward.
The most quite remarkable experience is learning from the natural practices and traditions of the culture, the Arabic culture, using the spices and the herbs, the frankincense and the amazing dates to ease labour pain. And in hospitals we've got policies about alternative therapies. There are some excellent evidence-based websites you can look at on the internet to see if it is safe, but you should actually consult your midwife or your obstetrician, because even throughout the UAE there's lots of homeopathic drugs for sale in the pharmacies, which can be very harmful to the unborn fetus or the mother and very dangerous. So you must be extremely careful and use it with caution.
At present, midwives in the UAE are only expatriates. The Nursing and Midwifery Council says there are 3 Emiratis currently training to become specialized midwives, whom they hope will encourage others to follow. Among them is Noura Salem Ali Alameri.
Especially here in the UAE, we are in multicultural society. Yes, we are locals, but also we have people from different cultures. So it's very important for the midwife actually to know a little bit even about each culture, because then she will deal with these people. At least she will not surprise, so she will respect, she can meet their needs.
In addition to preventive measures, treatments, best practices, and the latest technologies, efforts to support the growing demand in women's healthcare are also progressing. According to United Eastern Medical Services, they will open Janat Al Emirat by 2013 in Abu Dhabi, the first dedicated hospital to women and children.
The hospital will cater the needs of women and children of Abu Dhabi, and it will offer all kind of services for women, including gynecology, urogynecology and obstetrics, of course, and other services. At the same time, we will be having intensive care unit for neonatals, babies and children and adults as well.
The growing awareness and the initiatives being laid out by the public and private sectors, especially in the UAE, are placing women's well-being at the heart of healthcare and is taking a more progressive stance. Khadija Saleh, 7 National News.